Hello, my name's Dr. Ed Hope and welcome to Sick Notes, where I explain medical things in simple terms. But today, I thought we'd do something a little bit different. Well, should I say tonight, because I'm on a night shift and I thought you might like to join me.
Drowned in utero, the way that they get oxygen is through the placenta and the blood flow through the umbilical cord. Takes a breath, your blood oxygenates, and then that oxygen is taken to the placenta and transferred to the baby through the placenta, and the baby's deoxygenated blood picks that oxygen up and takes it to baby in utero. You breathe for your baby.
You go home with braces. I can't control what you do with them. I can't control what you eat. I can't control if you brush, because a lot of people get these white nasty spots around their teeth, the decalcification or cavities, and I wish I could just go help them. And as much as I tell them, they just don't do what I want sometimes and end up with those white spots.
My name's Dana, Dr. Dana Brems. For context, I'm a podiatry resident, which is foot and ankle surgery. So my typical day is a mix of surgery, rounding on inpatients, and seeing consults.
Tell you how many times I have sat there and listened to a guy tell me what a woman should have done. Sometimes I honestly just want to slap them. When a guy tells me she needs liposuction, I really just want to turn to him and say, why don't I liposuction you?
That includes insurance pre-authorizations, calling around to a bunch of pharmacies, coordinating really complicated outpatient care.
Dr. Austin Chang here. If you've heard about confusing things about gut health that you'd like to clarify,
have you ever had surgery? Have you ever wondered what happens when you're in a serene, anesthetic-induced sleep? What are surgeons doing when you're asleep? It's a good thing I'm here, because I'm going to lift the veil on what happens in the operating room that your surgeon doesn't tell you.
Have you ever wondered what quick health tips doctors from various specialties would give? From family physicians to orthodontists, each doctor offers a distinct perspective on maintaining health based on their specialized knowledge. What's the one piece of advice that could change your daily health routine for the better? We share easy and important health tips that you can start using today, right from the experts. Let's start with the health tips. Family medicine, Dr. Mike.
This is because too many people are using tools like Q-tips to pull out earwax, when in reality, they're only packing earwax deeper in and even damaging the skin, potentially leading to an infection.
Dr. Mike has one main advice for everyone. Never put anything smaller than your elbow in your ears. It might sound funny, but it's serious advice. Many people use small objects like Q-tips to clean their ears, but this can actually cause harm. Instead of removing earwax, these small objects can push it deeper into the ear canal. This can damage the delicate skin inside your ears and even lead to infections. Dr. Mike suggests avoiding these tools for ear cleaning to keep your ears healthy. Remember, sometimes it's best to let your body do its job without interference, and earwax actually helps protect your ears from dirt and germs. Ophthalmology, Dr. Glaucomflecken.
You think you've lost a contact lens or an eyelash in your eye? Don't worry, it cannot migrate back into your brain. That's something a lot of people worry about.
Dr. Glaucomflecken wants to clear up a common myth. It's impossible for anything to get lost behind your eyeball and travel to your brain. If something feels stuck in your eye, it's most likely just caught under your eyelid. The eye is designed with protective layers that stop objects from moving too far back. Dr. Glaucomflecken advises that if you feel something is in your eye, don't panic. Most of the time, you can gently flush it out with water or eye drops. This tip can save you from unnecessary worry and keep your eyes safe. Emergency medicine, Dr. Ed Hope.
It's super useful for us if you ever end up in the emergency department if you bring a list of your medication and any diagnosis you have and the dates of any significant illness or operation.
Dr. Hope has a helpful tip for anyone who might need to visit the ER. Always bring a list of your medications, any diagnoses, and details of previous surgeries or significant illnesses. This information helps emergency doctors treat you more effectively and quickly. Dr. Hope also suggests bringing a phone charger because waits in the ER can be long. Being prepared can make a stressful situation a little easier and ensure that medical staff have all the information they need to provide the best care possible. Obstetrics and gynecology, Dr. Danielle Jones.
Bromelain, the active ingredient in most powdered meat tenderizers, is actually a proteolytic enzyme. This means that on the steak, it breaks down proteins to make the cut more tender, but on a blood stain, it breaks down proteins to pull the stain out.
She has a practical tip for women. Don't throw away your favorite underwear because of period stains. Instead, rinse the stained area and apply powdered meat tenderizer. Let it sit for about 30 minutes before washing. The active ingredient in the tenderizer, bromelain, breaks down the proteins in the blood, effectively removing the stain. This simple hack can save your garments and is a testament to how everyday items can be used in surprising ways. Orthodontics. Dr. Winters.
What you actually want to do is angle it up at a 45-degree angle and get up underneath the gum tissue as well as the tooth, because some of your teeth hides up underneath the gum tissue and you never clean it. So turn that 45-degree angle, brush your teeth for 2 minutes, and your teeth will be cleaner than they've ever been in your entire life.
Dr. Winters shares that many of us are brushing our teeth wrong. He suggests angling your toothbrush at 45 degrees to your gums to clean the area where the gums and teeth meet. This technique helps remove hidden plaque and prevents gum disease. Brushing for 2 minutes using this method can lead to the cleanest teeth you've ever had. Have you faced any issues so far? And will you use these health tips? Let's discuss the next more useful tips. Podiatry. Dr. Dana Brems.
Toenail fungus is actually just Vicks VapoRub. It has eucalyptus and menthol, which are both antifungal.
She offers a surprising tip for treating toenail fungus. Use Vicks VapoRub. It may sound unusual, but the eucalyptus and menthol in Vicks have antifungal properties that can effectively treat the fungus. Simply apply a small amount of Vicks to the affected nails regularly. This affordable and accessible remedy can replace more expensive treatments and is a simple way to maintain healthy toenails. If you found this video helpful, please like and subscribe. Plastic surgery. Dr. Anthony Yun.
Is to put a drop or two of food-grade peppermint oil into your lip gloss and then mix it up and then apply the gloss onto your lips. It should create a very mild tingling sensation and your lips will gently plump up a bit.
Dr. Yun recommends adding a drop or two of food-grade peppermint oil to your lip gloss. This simple action can plump your lips slightly. When you apply this modified lip gloss, you'll feel a mild, tingling sensation. This is the peppermint oil at work, which mildly irritates the lips, causing them to swell lightly and appear fuller. Dr. Yun advises starting with a small amount of oil and increasing it only if you don't feel the tingling. However, if you experience any burning, immediately remove the gloss and start over with less oil. This natural method is a safe and inexpensive alternative to more invasive procedures, allowing for subtle enhancements without the need for medical interventions. Pediatrics. Dr. Alok Patel.
Babies and toddlers tend to have runny noses, a lot of mucus during cold and flu season, which lasts forever, and you can help them out with a nasal aspirator or a nasal suctioning device. It clears their nose, helps them sleep better, eat better, improves their mood, and potentially prevents a problem from getting worse.
One practical advice he shares is the use of a nasal aspirator for young children, especially during cold and flu seasons. Children often struggle with runny noses, which can lead to discomfort and sleep disturbances. A nasal aspirator is a simple device that can gently clear a child's nose of mucus, helping them breathe easier, eat better, and improve overall mood. Dr. Patel emphasizes that this method is not only effective, but also satisfying for parents as they help their children feel better. He assures that the process is straightforward and much less unpleasant than it might sound, making it an essential tool for parents during those tough sick days. Gastroenterology. Dr. Austin Chang.
We have ways to prevent this cancer, and it's often with a procedure called a colonoscopy, where we can actually take a look inside the colon, find these precancerous growths before they turn into cancer, and remove them. And that can actually help prevent cancer from happening.
Dr. Chang explains that colorectal cancer is the second leading cause of cancer deaths when combining men and women, but is often preventable through screening methods like colonoscopies. During a colonoscopy, doctors can identify and remove precancerous growths, significantly reducing the risk of them developing into cancer. Dr. Chang advocates for regular screenings, especially for individuals over the age of 45 or those with a family history of the disease. His advice underscores the critical role of preventive healthcare in combating cancer and emphasizes the importance of early detection. General surgery. Dr. Karen.
The most underrated life hack for optimized bowel health is probably just eating more fiber. Just increasing your fiber intake by 10 grams of fiber a day reduces your colon cancer risk by 10%. It's not a bad exchange. 10 grams of fiber is a banana and 2 slices of bread. Easy.
He highlights the importance of dietary fiber for maintaining optimal bowel health. Increasing your daily fiber intake by just 10 grams can reduce your risk of colon cancer by 10%. Simple additions like a banana and 2 slices of whole grain bread can achieve this increase. Dr. Karen's advice is straightforward but impactful, offering a practical way to significantly improve long-term health outcomes. His approach to preventive care through nutrition not only helps in cancer prevention, but also improves overall digestive health, making it a vital piece of advice for anyone looking to enhance their dietary habits. We hope these expert health tips inspire you to make simple yet effective changes in your daily routine. Don't forget to like, subscribe, and click the bell for more insightful videos. Stay healthy, stay informed, and see you in the next video. Thanks for watching.